organizing this special event in the view of World Disability Day, which is tomorrow. And we decided to bring a platform for all the parents to ask their doubts or any questions about the emerging trends in the therapies, and how we are actually moving away from the therapies what we were giving 40 years back, and how new researches are influencing the various different kind of interventions and therapies which are more helpful to our children. So 10:30 to 11, our physiotherapist, who is MPT in neuro, Divya, she will be answering motor related questions. Then 11 to 11:30, our speech therapist, they will be taking the questions related to speech and language. Then 11:30 to 12, our occupational therapist, Deepa Priya, she will be taking questions based on for sensory or motor difficulties. And then our psychology team will take over and we will be answering all the questions related to parenting or psychology or RDI or co-regulation or SPED, whatever is there. So I invite Divya, and I would like to start with a question myself from Divya. Divya, would you like to throw some light on the emerging trends in physiotherapy? See, earlier, 20 years back, of let's not even go 20 years back, 10 years back, I never heard that children with autism are given any physiotherapy because we never knew that there could be underlying motor deficits. And what we heard that children with cerebral palsy or physical disabilities were given physiotherapy. But now I'm seeing that physiotherapy is also starting to be given to children with autism. So I would like to ask you this question, that why why physiotherapy is so important for children with autism also. So please explain it to us. So I hand over the mic to Divya now.
Thank you, ma'am, for the warm welcome and for asking me a good question, which is really helpful for all the parents who are joining this. Because, as you said, there is less awareness about PT related to autistic conditions or any related disorders. So PT is if when I say or suggest any parent about physiotherapy, many parents will ask, my child does not have a disability or my child does not have any pain or anything. Why should I suggest physiotherapy? Why should I go for sessions of physiotherapy? So I would say our entire body is made with muscle, right? We are made with muscle, bone, and ligaments. All of these are the important structures of our body. So there is something called tone in our body. A tone is something that our muscles will have minimal contractions. See, if I don't have a tone in my hand won't stand this way. It'll just flap like this. That is what happens when a person who does not have the motor planning to maintain that tone. Our children who are under the spectrum or who are having any related disorders will have difficulty in motor planning, right? So when you say any work, or if you just give them a task of playing, let's say playing, it will be a big task for them because their motor planning is disturbed and they can't maintain that minimal tone in their body. So holding a water bottle is difficult for them, not just because of their fine skills. It is about based upon their motor planning also. It is based upon their planning of, okay, how much strength I need to hold a water bottle. All of this has to be done by a physio also. I agree that occupational therapy is needed, but physio works on the same task but in a different point of view. We have a point of view of increasing the muscle strength, of improving the posture. There are, coming to the posture, there are many questions, and people ask posture in the sense, my child is not drooped, my child does not have any disability in walking. Posture comes when a physio looks in a way of the spinal alignment. This spinal alignment plays a big role in speech also. So this is how, like, there are very interconnected and looped structures for physio related to autism. So yeah.
So, Divya, will you be able to tell us some of the missing early foundations, some of the missing early motor foundations, which actually later manifests as social or communication or speech or language related difficulties? So, is there any connection between motor and social communication and language? So, will you be able to elaborate on that?
Yeah. So this question might sound complicated, but it has a very single statement, I would say. Imagine, let's say, a person is having very less strength, very less confidence to do basic activities or to communicate to people beside them or in the community. That person will have very low confidence to communicate because of the physical disabilities, right? So when we have that improper, or if I can say, wrong posture, or a wrong trunk alignment, or a wrong muscle strength, or anything in their body related to what physios work on, their confidence level gets affected. They'll have very low self-esteem, and that will affect their social communication skills. But coming to language, language has key factor called breath, right? If a person can't breathe, there is no way that a person can talk, because our vocal cords or the muscles that are used to produce a sound needs motor tone again. So when a person does not have enough strength in their sitting posture or doing general gross skills or fine skills, I'm pretty sure that will affect their speech also. There is no a case where I have seen in my experience that a person can speak very well, but he can't do any fine skills or gross skills. Like he's zero in one and perfect in speech. There is no such case like that. It is interrelated. So early foundations, if I say, like small things that the parents might miss is head and neck control, or lying down on their tummy. So the small milestones which the children have to cross are the initial signs the parents have to think that this person needs to work on the physical actions also.
Um, Divya, can you tell us what are some of the missing milestones which generally we have observed in the population of children who later are diagnosed with autism? So, in the first 6 or 7 months or first year of their life, uh, which we miss out. So, we don't even realize as parents because we are not knowledgeable at that time, but we miss out that. Some of the milestones which our children do not achieve, but we do not know about it. So what are some of those things which a parent should be vigilant about in the first year of child's life to realize that there are something is going wrong basically? So what are some of those things which can indicate that something is going wrong with my child and I should take some necessary actions, and then that particular child, the chances of him getting the diagnosis at the age of 3 becomes high. So would you be able to tell us what are those missing milestones?
Sure, ma'am. Initially, in the first year of the child's life, the parent actually spends a lot of time, right? Because the child is in a stage of his or her life where they need utmost attention. So, few classic signs I would just give for the parents and for the therapists who have joined here, that in future they might need to go for a proper session and then have to give a red flag for it. So first would be a head and neck control, as I said before also. That is the initial sign. And or we should have our entire childhood. So that is the initial sign. And okay, so yes. So the initial sign would be a head and neck control. And when head and neck control, there is one case in my last years of experience. I have seen the head and neck control. The child did not develop till 2.5 years, and that's when the pediatrician has suggested that he has to go for a screening of autism. It might be very like shocking to see that okay, just head and neck control has made my child autistic. It's not that, it's just a physical sign we can see outside. Internally there is so many things that we can't just assess initially, right? So when a child is not speaking about 3, that's when a parent might notice. But when the child is not stabilizing his head in the first year of life, you need to give it a red flag. And when the child is not able to grasp small things, grasping is something the child will develop when we are giving, when we are feeding a child, or just hold the hand of the child, they'll have a inbuilt reflex like grasping a finger. We find it very cute, but it is because of the grasp reflex that has to be there, and that has to be retained slowly with 1 year of time also. If it is still present and intact, even yeah, integrated, sorry, integrated even after that, that is when it can be considered as a red flag also. Because there'll be a phase of time where this reflex has to show up and it has to fade away. If it is being prolonged, that means there is a something that has to be worked upon. And maybe it can help the parent to understand, okay, let's maybe go for just a screening to figure it out or strike it out. And there is something called sitting also, right? Sitting attains easily for the children who are always being supported with wall or chair, but without any support for their back. If they're able to sit not in a W posture but sit by themselves, play or anything, they can just sit and turn their head. That will help where their head will be aligned to their trunk. Like their head has to be aligned with their trunk and rotate whenever they're playing, grasping things. These are the small things that the child has to show up within the first year of his or her life.
So, Divya, um, most of the children I have worked with, or I have seen or interviewed the parents, crawling is one milestone which is often missed. So, what is your opinion about it? The importance of crawling, and why? I mean, what foundation does crawling develop for the future skills of child?
So coming to crawling, actually it helps in stimulating all the body's joints, the child's joint of hip, shoulder, knee, and the wrist. See, when we are in a kneeling posture or in a crawling posture, you can notice that you're keeping your entire weight on your shoulder and wrist on the upper body, and in the lower body on your hip and the knee. Right? When the child is not exposed to such kind of pressure or proprioception, they might actually miss it. So I would suggest who are parents initial phase, like don't carry them a lot. So crawling actually helps in giving them ATNR and STNR, which is the important reflex of their childhood. See, when the child is not able to crawl or weight bear by themselves, that means their hip and the knee is having less strength compared to a typical child. Our children actually might face trouble to walk a lot or sit down for for a good period of time, the sitting endurance, or holding themselves, or maybe doing some activities which has to cross their midline. All of this comes with crawling. You might say crawling does not have this, but crawling does have in a crisscross pattern. The right knee goes front and the left hand goes front. That way it will be in a cross posture, right? So this motion actually helps in crossing the midline without us knowing in the initial phases of time. Imagine a child is not able to cross and has missed this phase of time. I'm pretty sure the child will have discomfort or difficulty in doing any activity which has midline crossing or weight bearing activities.
So if my child has grown up, see, when my child was 1 year old or 6 months old, my child missed that phase of crawling and directly started walking. And I didn't realize the importance of this milestone at that time. And then at the age of 3, my child got a diagnosis. Now, say my child is 8 years or 12 years or 16 years, whatever is the age. And I do realize crawling as a foundation. And if I really want, if Do you think at that age I should be doing something about it? Say at the age of 8 or 12 or 16 or even 20. Should I be doing something about it? And what can I do for a child who's already grown up? So will you be able to give us some pointers on that, some suggestions and some guidance?
This is a really helpful question for all the parents, ma'am. Yes, we can do it. It is not something that it is irreversible. See, when a child has passed it and has started to walk and is completely fine and has been diagnosed in the later part of the time, but you already missed it, it is in the past. What you can do is, I would suggest there are three things you need to focus on. One is the muscle strength. First, initially start by building up the muscle strength. If the child is having a discomfort in doing any weight bearing exercises or midline crossings or crawling or kneeling, what you'll have to do is strengthen the muscles which are helping in these postures. See, for example, if you're able to kneel down, work on your back muscles, work on the leg muscles, do some daily exercises, increase the flexibility of the child. There are many programs out in the market where you can work on the muscle strength. You can either go for a gym with your children, go for a run, or do any sport. Focus on their muscle strength. First, improve their muscle strength, and second comes their joint proprioception. When you keep working on activities of weight bearing in the sense, you just have to make them just take an easy task of jumping. Even jumping also gives a good proprioception for the hip and the knees and the feet. So these kind of activities give them more, stimulate their joints, increase their range of motion. Range of motion, if many people might not know, I would say it is the complete range of motion, like a complete range of motion a joint can do. That is called range of motion in medical term. So work on that. And the third thing is integration of these reflexes. Work on doing some exercises that can trigger the brain to plan the moment. Like there are few exercises, you can go to our YouTube channel in Play Street, so you can find few exercises which we have uploaded for ATNR, STNR, to integrate them. Make sure you keep those activities first, try it as an exercise. If the child is doing it comfortably, include tasks in it. So I would just give an example of one exercise which you can do right here on the chair. Lift your hands up and then stretch your legs out. So the child has to self hug, cross the legs, and open. This would help in increasing the crisscross pattern. If the child is able to do, start with function movements. Maybe you can ask, take these glasses and put it on this side of the table, or take these plates, put it on this side of the table. Like give weight bearing exercises. Maybe you can try with wet clothes, or you can try with heavy objects the child is not easily exposed to, but give that. Why I'm giving these exercises is it won't be a task for the child. If you keep giving a task for the child on and on and on, it will be very overwhelming. So include it in a functional activities. These are the three things I would suggest if the child has passed it and has been in a later stages of his life.
Uh, if anybody has any question, please ask the audience. Subhashri, Shachi, Meghna, you can unmute yourself and ask the question. Otherwise, I'll take the next question in the meantime. You guys think of the question. Divya is here. Divya, now please tell us something about gait. Our children are walking, but in my experience, a child with autism, I have not seen a proper gait in any child with autism. So please help us to understand about the gait and the impact of having the wrong gait in child's postural system and regulation, and further, whatever, like, please help us to understand that. What is gait? Please first help us to understand what is gait. Yeah.
Yeah, so gait is the pattern of walk we notice or assess. It's the pattern of how the lower limbs are moving or the whole body is moving while walking. That is called gait in a whole package. There are many things which we focus on. I just gave it as a brief to make you understand about gait. So, as you said, ma'am, it's true. I have never noticed a child who is under the spectrum who is having a good gait. there'll be some or the other minor to major disorder in the posture or in the gait also. So there are different types of gaits which we assess, and just looking at the gait we can tell that there is something underlying issue. So first of all, a normal gait would be in a pattern where the heel of the leg has to touch the floor, and then complete weight bearing, and then heel off, and then the toes will go off. This is the normal pattern. If in anywhere the child is sorry, yeah. Yeah, so sorry for pausing for a minute because we have some parents who are offline coming and joining us, so we are just welcoming them. So I was telling about gait. I'll just repeat it again because there are a few parents who just joined us. Gait is something that we assess. It's a pattern of walk which we notice. It has many segments of walk which we in a whole package just assess. Gait is a term which we use to assess the pattern of walk. So coming to this, as ma'am said, there is no child who is under the spectrum and who is having a very perfect walk. Somewhere there will be a difference among one child to another child in their pattern of walking. So there are few underlying causes for this disturbed gait that we notice in our children who are under the spectrum. So this is something which we can notice because of the muscle weakness. So one classic sign you all must be knowing who are having any related symptoms of autism is toe walking. So they do this classic toe walking because of tightness of one muscle in our leg called hamstring. So this hamstring muscle is tightened for them. They go for this toe down posture, which is called toe walking in general, how we know. That is because not just because they have sensory issues to keep their entire feet on the floor. There are underlying motor issues like the muscle tightness or the muscle fibers being very taut. They'll be very hypertoned. In the previous question I answered about tone, right? So this tone becomes hyper for them. The muscle tone will be so tight that they just keep contracting the hamstring as much as they can. So as much as this one is become tighter, the bones will get adapted to us. Our human body is made in such a way that however the muscles are, the bones will get adapted to it. That is what happens in a fracture healing also. They pull the fracture out so the bone can elongate. The same thing happens with our children. When they keep walking in a toe walking posture, the bones get elongated and might affect their hips also. So there is a classic sign which physios notice is posterior pelvic tilt and anterior pelvic tilt. We have explained it in a very good manner by Minimum also. So in sooner we'll explain, make it as a good course. So it's just a teaser. So this posterior and anterior pelvic tilt is something which we notice while the child is sitting also. So there are children who tend to sit in a posture where their spine goes like this. They love to sit this way. That is their comfort posture. Even as adults who are like typical also, even me, I have a comfortable posture of sitting this way. I know this is not correct, but still my body is adapted to this, so I just slouch and sit this way. It affects my spine. So our children can be noticed with this kind of postures of either chest out and back in, and then one posture is where they walk this way. They walk this way that their shoulders just go this way. So these are the posterior and anterior pelvic tilt which will get affected of gait. So posture and gait is complete two different subjects, but both of them get affected because of each other. Gait, if the child is not walking in a good pattern of maintaining their line of gravity and their base of support, and it goes in a way where the legs will either crisscross or toes out or toes in, toes up, toes down. Anything if these are noticed, the posture will also get affected. So what you can do to get the child overcome this kind of discomfort is give them flexibility exercises. and give them some training exercises like walking on a tape or walking on a balance beam, tandem walking, or walking tiptoes, or if the child is walking on heels. If the child is walking on toes, try heel walking, or doing some exercises like squats, strengthen the lower limb muscles. So these are the advices I would give in terms related to gait.
Absence of speech or absence of language is something what we observe and notice. But other like sensory and the motor difficulties and the deficits which are leading to language difficulties, something we do not know because that is so internal. So Divya, what is your take on this? That how does my postural system affect the rest of the functions of my life when I grow up as a child, as an adolescent, as an adult?
So, coming to this language and speech, that is the classic thing the parents ask us also. My child is not able to speak. My child is not able to squat, it's fine, but my child is not able to speak. That's my main focus. That's what parents focus on. But it's fine because that's the thing every parent want. Every parent want their child to speak or call them. That is there. But think about in a way where maybe their physical strength is also affecting their speech. Maybe you can focus on this one also. It's just a change of point of view. Just change your point of view from the gross skill also. So how posture or how a physical gross skill will affect a speech, if you were in a state of confused, how is it really related? I would just give you a classic example. Now whoever is joining this call, just follow me, okay? Just sit in a slouch posture, just close your limbs and just say ah. You can only say it in a very low toned voice, right? Now open, sit straight. Now say ah. It is more clearer when this ah. I'm pretty sure.
Yeah, it is because breath is
Yes, the breath is complete.
because complete exhalation cannot happen. So yeah, the I mean, so we have an intact system, so we will be able to do it. But children, those who are born with a disability, for them, they won't be able to do it, right? So, um, so Sarah is waiting. So anybody, those who have speech and language related questions, you are most welcome.